Good day. My name is Tammy-Lee Pretorius, and I work for the University of the Western Cape in the Faculty of Community and Health Sciences. The title of my abstract and study was Depression Among Healthcare Students in the Time of COVID-19, the Mediating Role of Resilience in the Hopelessness-Depression Relationship. The keywords were COVID-19, depression, hopelessness, mediating, and resilience. The outline of my presentation today will cover the introduction, the aim of my study, the methods used to conduct the study, how I analyzed the data, the results of my study, as well as the conclusion and implications of the results. COVID-19 spread rapidly across the world, and in March 2020, the first case of COVID-19 was identified in South Africa. Lockdown-related measures such as restricted movement and isolation were implemented to contain the virus. Combined with these measures, factors such as economic decline, job losses, and food shortages can cause numerous mental health consequences, such as depression. Feelings of hopelessness and helplessness, as well as cases of suicide, have been reported around the world due to the pandemic and the associated feelings of anxiety and depression. The aims of my study were twofold. Firstly, to investigate the levels of hopelessness and depression in a sample of healthcare students. Secondly, to investigate the potential mediating role of resilience in the hopelessness depression relationship during COVID-19. The methods used to conduct the study: a random sample of students were used, which totaled 174. Most participants were female at 82.2%, as well as resided in an urban area with 73.4% of the students. The mean age of the students were 21.8 years. All the students were enrolled in any one of the various health sciences programs at the University of the Western Cape. The questionnaires used to collect data consisted of the Beck Hopelessness Scale, the Center for Epidemiological Studies Depression Scale, which measures overall depression as well as positive effects, depressed effects, and somatic activity. Lastly, a three-item resilience scale was also used. Data analysis. This model was used to test the relationship between the various factors. The model presumes that hopelessness is associated with depression and all the subscales, and that resilience mediates the relationship between hopelessness and depression. The total direct and indirect effects of hopelessness on depression were determined using AMOS version 26. Indirect effect is a measure of mediation. The results The results showed that all the paths between hopelessness and depression were significant. The results further found that high levels of hopelessness and depression were present compared to previously reported normative data for these scales. Further, hopelessness was significantly related to all aspects of depression. Significant indirect effects of hopelessness on depression were found, with beta coefficients of minus 0.08 and 0.13. Lastly, this is the demonstration of the mediating role of resilience in the hopelessness depression relationship. The conclusion and implication of these studies. The results highlight a call for universities to take proactive measures in providing students with free and easily accessible resources to help them cope and manage stress during a traumatic event. On a national level, more importantly, preventative measures should be implemented to strengthen resilience in young adults. Thank you for listening. If you have any questions, you can contact me on tapretorius@uwc.ac.za.